Hi everyone, I'm Karen Bain from Eisenstein Flaherty and Associates. We know over the past few weeks there's been multiple information coming to you, and what we wanted to do is to develop a few short clips regarding donning and doffing personal protective equipment using the most up-to-date information from the Center for Disease Control. So by doing that, we'll have one video on donning or putting on personal protective equipment and then one video on removing it. What's been identified is that in several cases, even things that I've observed is there are some challenges with donning and doffing personal protective equipment, and what we want to do is to make sure that everyone is using the proper technique to make sure that everyone is staying safe. Donning or putting on personal protective equipment. This will include the latest guidelines for the Centers for Disease Control, their recommendations on putting on personal protective equipment. There is an appropriate sequence that should be followed when putting on your personal protective equipment. So let's get started. We'll first start with hand hygiene. An alcohol-based hand rub, putting it in the center of your palms, making sure you're getting both sides of your hands, interlace your fingers, make sure you include your thumbs. You want to interlace your hands and make sure you get all the surfaces of your hands. This should take approximately 20 seconds until the product is dry on your hands. The first piece of personal protective equipment that we're going to put on is our gown. So you want to take your gown, take a look at it, make sure it doesn't have any holes or tears. The gown should never go over your head. You're going to put your arms into the gown first. Then fasten your gown at your neck and at your back. You want to make sure when tying your gown that you tie it in a bow so it'll be easier to release when you're taking off your gown. Your next piece of personal protective equipment that you're going to put on is your mask. We don't have an N95 here, we have a regular mask, so I'm going to show you how to put that on. If you're using an N95, there is a specific way to appropriately don that piece of equipment. So for your mask, again, observe it. Make sure that you can feel the top of your mask. You have the ability to bend the top of your mask at your nose, the top of your nose. Make sure it's fitting well, and then loop the elastics around your ears. If you have ties on your mask, you're going to tie the top ties first and then the bottom. As you hold the top of your nose, make sure you pull your mask down over your chin so your nose and your mouth are adequately covered. And you just want to make sure that it has a nice, tight fit. The next piece of equipment you would put on are your goggles, or if you have a face shield. Take your face shield, you're going to press the top piece right against your forehead, place it around your head, adjust the fit. It's really important that all of your personal protective equipment feels comfortable before entering your patient or resident's room, because you don't want to be adjusting as you're in the resident's space. The final piece of equipment that we will be putting on is our gloves. We know the gloves come in various sizes, and just make sure that the size that you're using is appropriate for your hands. And as you put on the gloves, pull the gloves up over the arm of your gown so that all of your skin is covered. So those are the proper steps for putting on personal protective equipment. Doffing or removing personal protective equipment. Again, you want to keep in mind that there's an appropriate sequence for removing your personal protective equipment. You want to perform this very carefully and meticulously to make sure that there isn't any cross-contamination when removing your PPE. So let's get started. The first thing we're going to do is to sanitize our hands, our gloves. So this would take 20 seconds, utilizing the hand sanitizer on all aspects of our gloves. The first piece of personal protective equipment that we're going to remove is our gown. So you want to remove the tie at your neck first, and then the tie at your waist. You want to bring the gown away from you and roll it into a ball, making sure that the outside of the gown, the contaminated part, is on the inside. You would then dispose of your gown. The next piece of personal protective equipment we're going to remove is our gloves. So take your dominant hand, grab a hold of the center of the palm of your non-dominant hand, and peel that glove away. Grab it in your gloved hand in a ball. Using your index finger, slide it into your other glove on the inside and pull the gloves away from you and dispose. At this point, we're going to use our hand sanitizer once again. And again, you would do this process for 20 seconds. The next piece of equipment that's coming off is your face shield. So you want to grab it at the back, at the elastic, over your waist receptacle, and gently it will fall into your basket. All of that personal protective equipment is removed inside the patient or resident area, closest to the door, and you would take all that equipment off inside. Before removing your mask, you're going to actually leave the patient care area just outside, and we're going to hand sanitize once again. Again, your 20 seconds, making sure you get all the surfaces of your hands until it's dry. To remove your mask, again, you want to make sure that you don't touch the outside of your mask. If you have ties, you would untie the top first, then the bottom. Make sure the inside of the mask stays facing you and drop that into your waist receptacle. We would then perform hand hygiene. So as you can see, there are a few additional steps that have been added when we have a patient that is positive for COVID-19 or suspected to be positive. The CDC recommends adding these additional steps. So please stay safe, be well, and make sure that your associates are performing the right personal protective equipment donning and doffing. Thank you so much.